signatures, misrepresentations, improper use of personal information, aggressive sales practices, cross-selling when they go in to sell a Medicare Part D plan and sign up the senior for a Medicare Advantage plan that they were not interested in. I've talked with seniors one-on-one personally that have been subjected to these abusive marketing practices. I've been called by the directors of senior centers that have had to deal with agents coming on site uninvited to solicit folks that live in the senior center. But worst of all, many seniors with dementia and Alzheimer's disease have been targeted by these sales practices, largely because there have been huge commissions involved. Now, the Congress did act and gave CMS some additional authority, and CMS is trying to pick up their oversight, but they just haven't been able to do the job. And it's very important that we return this authority to the states to investigate the consumer complaints, provide oversight, and ultimately hold them accountable. This amendment has strong support by the National Association of State Insurance Commissioners, and in their letter of support have written, though the Centers for Medicaid and Medicaid Services has made greater efforts to improve oversight in recent months, it has neither the staff, the expertise, nor the experience in regulation of plan marketing to effectively protect seniors. The states, on the other hand, have experience and relationships with plans to correct problems quickly and to prevent these problems from reoccurring. The states are closer to what's happening on the ground, and often the state is more responsive directly to our seniors. They go on and write, the amendment will correct the situation by allowing state regulators to hold Medicare Advantage and Part D plans responsible for their marketing tactics. Plans will operate under a single nationwide set of marketing standards drafted by regulators with experience in consumer protection, with input from consumers, plans, and CMS, which will formally adopt the standards and enforce them at the state level. This is a proven framework that has been used successfully in the regulation of Medicare supplement insurance for over 16 years. And under the amendment, states will be free once again to assist consumers and hold Medicare Advantage plans accountable for their marketing sales tactics. So I urge my colleagues here to adopt this amendment and move it forward.
The gentleman yield.
I'd be happy to yield to Chairman Stupak, who did tremendous work on this subject.
Mr. Stupak.
Thank you, and thank you for yielding. You're right, we had no eye hearing on this, and the deceptive practices they used on senior citizens to get them to sign up for Medicare Advantage was amazing. They'd bring out cards that looked like Social Security cards and tell people they're signing up for Social Security, and they were really signing up for Medicare Advantage. The tactics, everyone condemned it. The insurance commissioners, everybody has condemned these aggressive tactics and abusive marketing and sales practices to get people to sign up to Medicare Advantage. This is a very good amendment. It would go back to get the preemption back there. Before the 2003 Act, you could not use these practices. The 2003 Act allowed this abusive practice to go on, and as I said, we've had a hearing on it. A good amendment. I would urge all members to support it.
Thank you. The gentlewoman's yields back.
Yield back.
Gentlewoman's time has expired. Any further debate on this side, on this amendment? Mr. Deal?
I'd like to engage counsel in a few questions. I think we understand what the goal is here of trying to set standards with regard to people who are conducting activities that may be considered somewhat fraudulent. As I read this amendment, it appears that we are delegating authority to the National Insurance Commissioners Organization to come up with these standards. Is that the way counsel interprets that?
As I understand this, there are two provisions provided for. One, if the Secretary is to request the NAIC to make recommendations. If the NAIC makes recommendations, the Secretary has to promulgate regulations for the adoption of such requirements. And the such requirements language would, in my mind at least, allow some possibility that the Secretary makes changes to it. If the NAIC does not, however, submit a report, then the Secretary has full discretion to make her own decisions about how to set up standards.
I suppose the first one causes me more concern than the second one, because I think it would be within the Secretary's prerogative to promulgate regulations. It appears, though, that the language you just quoted might say that whatever the standards that are developed by this outside entity, the Insurance Commissioners Organization, that the Secretary shall promulgate regulations for the adoption of such requirements. My concern is a legal concern. Is this going to be considered an unlawful delegation of legislative authority to a non-elected outside entity to give them sole discretion in terms of promulgating these rules, which will ultimately become regulations which will have the force and effect of law? Do you have a concern about that?
No, sir, I don't. First of all, the non-delegation doctrine has been held to incorporate many provisions that are much less specific than this. Secondly, since it does not delegate to the NAIC the authority to issue regulations, but tells the Secretary to issue regulations, she could review these recommendations and adopt regulations that she, in her discretion, believes incorporate such requirements. And since the courts have routinely recognized that in interpreting ambiguous legislation, the Secretary, under Chevron deference, is given deference, I have no concern that this is either over-delegation of authority or strapping the Secretary down.
What are the penalties for violating these standards? Where are they?
Mr. Deal, I do not see specific penalties in this provision. I would assume that the Secretary could either, as she promulgates regulations, incorporate specific penalties, or she could consider that a failure to meet these standards would result in an inability for these plans to participate in the Medicare program.
So we don't know whether there could be monetary penalties, civil monetary penalties, or whether the penalty would be that if you don't meet the requirements, you just cannot participate in a Medicare Part C program.
As I read it, in my reading of this language, sir, that is delegated to the Secretary to decide. The Secretary could decide whether to incorporate something short of absolute banning from the program, or she could decide that violation of these regulations prohibits you from participating in the program.
Wouldn't we normally know what the sanctions could be in the context of something we're adopting rather than having to guess at it?
The Medicare statute is, of course, long and complex, but in many cases, sir, I believe that it is delegated to the Secretary to decide on the most appropriate enforcement device.
I yield back.
Gentleman yields back. Any further discussion? Gentlewoman from Wisconsin.
Thank you, Mr. Chairman. I move to strike the last word.
Gentlewoman, proceed.
Thank you. I won't take the entire time, but I do want to strongly support Ms. Castor's amendment. My home state of Wisconsin is very enthusiastic about seeing policies such as this incorporated in our larger bill. The current configuration of Medicare Advantage plans make it impossible for beneficiaries to make fully informed decisions about which policies to buy. And I think that transparent and standardized marketing will help beneficiaries in that regard to a great extent. And I think it's vitally important that the states have regulatory authority over these plans with respect to the marketing activities so that states can properly protect their Medicare-eligible citizens and hold Medicare Advantage plans responsible for the acts of their agents. By allowing the states to adopt standardized marketing guidelines as state law, and thereby allowing states to enforce those standards, Medicare beneficiaries will be better protected from unscrupulous plan or agent activity. These provisions allow for a much stronger partnership between CMS and the states in protecting Medicare beneficiaries, and these provisions, I don't believe, would diminish the federal government's authority over plans they contract with, nor would they usurp CMS's enforcement abilities over the plans. So for those reasons, I think this is a very important amendment and would urge its adoption.
Tammy, would you yield?
I'd be happy to yield to the gentleman from Michigan.
Yes, let me just, Medicare Advantage or Medicare Part D preempted the state insurance commissioners from regulating the plans. The state of Michigan, any state, you regulate the agents, you have authority over the brokers, but when it comes to Medicare Part D, you can't say what tactics you're using in your state to sell this plan. And when we had our hearing, Democrats and Republican insurance commissioners, I think Florida was one of them, came and said, look it, please just let us regulate the plan. They're selling it in our state. We can't do anything about it because you preempted us. Before 2003, we could always regulate the brokers, the agents, and the plans and the sales tactics being used in our states. You preempted us. We can't do it anymore. So what we're saying, and if you look on page 8, no preemption of state sanctions. Let the states do their job like they did before we had Medicare Part D. If we're going to have Medicare Part D, whether you like it or not, we have it. But at least let the states do their job. The commissioners have unanimously asked us to let them do their job, regulate it like they did before 2003. Why is it we allow them to regulate the insurance agents, the brokers, but not the plans or the sales tactics being used in their states? This is a good amendment. I hope we would support it. Thank you for yielding.
Will the gentlelady yield to me?
I'd be pleased to yield to the chairman.
Thank you. I just want to say that the chair supports this amendment. As has been mentioned, it would add new enforcement ability by allowing state attorneys general and insurance commissioners to enforce federal law. Basically, the number of cops on the street, so to speak, would be increased dramatically. And I want to thank Ms. Castor for putting forth this amendment. Does anyone else?
Chairman, Mr. Chairman.
Is anyone else on this side?
Well, I control the time. Would you like me to yield back or yield to the?
If there's anyone else on this side, if not, we'll yield. You can yield to the gentleman from Texas.
Who seeks recognition on the? Oh, I'd be pleased to yield to the gentleman from Texas.
I appreciate getting the time. And I just had an additional question for council along the lines that Ranking Member Deal was asking. I guess I'm a little confused after this last exchange. Who then is going to retain the regulatory authority under this amendment? Will it be the Secretary of Health and Human Services, or will it be the state insurance commissioners?
The amendment specifically removes the preemption of what would otherwise be state law. It also directs the Secretary to issue her own marketing regulations after receiving recommendations from the NIC. So I would understand this to be both levels of a government could regulate this, both the state and the Secretary.
Now, in your answer to Mr. Deal's question, you don't. It doesn't seem to be spelled out what the penalties are for noncompliance.
The Secretary of HHS under the Medicare Authority has general authority to decide either intermediate sanctions or barring someone from the program. We've just been going over the placement of the amendment in the statute to see if it required either or if it simply allowed both. As best I can tell at this point, it would allow either up to the Secretary's decision. She could impose an intermediate sanction such as a civil money penalty, or she could bar the plan from participating. But by the placement of this amendment in the sections that it's in, I cannot find anything that would say specifically what the remedy would be.
The gentlewoman's time has expired. If the gentleman from
Unanimous consent
Texas,
for one more.
well, you could actually seek time on your own.
Very well. I move to strike the record.
Gentleman is recognized for 5 minutes.
On the going on that issue, then, if the Secretary found against a company, decided on debarment rather than a civil monetary penalty, what would be the rights of appeal for that company? Would there be a right of appeal? Would that be a final decision that would exist in perpetuity?
Again, I apologize, sir. I'm hypothesizing a great deal since we're going from NAIC recommending to the Secretary then promulgating regs. But there is generally, in the Medicare program and in the Medicaid program, a departmental appeals board, which any dissatisfied contractor or beneficiary can appeal to for a regulatory decision. I do not see anything in specific in this amendment which would stop the Secretary from using that General Departmental Appeals Board. Once a I'm also advised that there are specific provisions providing procedural protections for termination in addition to the Departmental Appeals Board, and that those would be available here.
And that's in the language of the amendment or in
No,
the
that's in the language of the
underlying
existing
statute?
the underlying statute.
And would that provide for a fair hearing for a company?
The language actually says including opportunity for fair hearing. That's current law.
Okay, thank you. Thank you, Mr. Chairman. I'll yield.
Will the gentleman yield?
Yeah, I'd be happy to yield to my friend from Arizona.
I'm very much inclined to support philosophically this amendment, but I'm pretty deeply troubled by it. What I hear is that, at least listening to Mr. Stupak, the law currently preempts state regulation of advertising on certain types of plans. And so the proponents of this amendment are saying we should allow the states to regulate those plans. And yet, as I read the overall structure of this bill, it moves all healthcare regulation, what has to be in a plan, what can't be in a plan, how the plan advertises, what minimum benefits have to be provided, what appeal standard has to be provided. It's moving all of those things from regulation at the state level right now, which currently exists, to regulation at the federal level. That is spelled out quite clearly. If you go through the early parts of the bill, it talks about each of the things that a qualified health benefits plan must have, and it really prescribes that those are to be set at a federal level by the federal government, by the bureaucracy created in the bill, and all of those things are currently done, at least with regard to individual plans, at the state level. And I guess I'm a little bit twisted here. On the one hand, we're saying, well, it's bad that in prior legislation we took the authority to regulate away from the states, and we ought to, in this bill, give that authority to regulate, here specifically advertising, back to the states, and yet the entire remainder of the bill is replete with requirements: affordable coverage, essential benefits, consumer protections, what must be covered. It creates a board to recommend what must be covered in the future. It goes on and on and on and on and on, federalizing all of those things. And I'd like to ask the proponents of this amendment why this one item should be shifted back to the states when we're moving all of the other items to the federal government.
Gentlewoman from Florida.
I think there is a little bit of confusion, and I'd like to ask counsel to address the gentleman's concern.
Mr. Shadegg, if I may, the provisions that you are describing are part of Division A, which is
They're still a part of the bill. I mean,
Yes, sir.
They're all through the bill. I mean, I was just reading some of them off just a moment ago. The bill says what the essential benefits for every plan in the nation must be if it's to become a qualified plan, what the affordable coverage provisions must be for every plan in the nation, spelled out by federal law, taken away from the states, currently regulated by the states, what consumer protections must be offered, all the way down to, prescribing that must have mental health parity, you must cover substance abuse. All of that is prescribed at the federal level under the bill, and yet this amendment says we should give freedom back to the states.
Gentleman, yield.
Well, I'm anxious to get counsel's answer.
Counsel will respond.
to the extent that I can respond, sir. The bill generally in Division A makes many functions, takes many functions on at the federal level. It does preserve the regulation of state insurance at the state level. In addition, the federal level is a floor, not a ceiling. The amendment before us at this point is about Medicare, not about the new exchange plans. So that was the point that I was trying to make before, but I take your point that the bill itself takes many functions to the federal level. And I would only say that the bill does preserve the regulation of insurance at the state level.
I thank the gentleman. My
Gentleman,
time's expired.
Gentleman from Texas, time has expired. All time has expired on the amendment. The question now is on the amendment by Ms. Castor. All those in favor of Ms. Castor's amendment? Gentleman has a point of order? Oh, I'm sorry. Point of order has been withdrawn. So the question is now on the amendment by Ms. Castor. All those in favor of the amendment say aye. All those opposed say no. The ayes have it, and the amendment is adopted. We have an amendment on the Republican side? No? No additional amendments? Do we have any? Oh, Mr. Rogers? Mr. Rogers?
Chairman?
Clerk will report the amendment.
Amendment offered by Mr. Rogers of Michigan. Add at the end of Part 2 of Subtitle D of Title I of
I'll ask
Division B.
unanimous consent that the amendment be considered as read, and I would ask again the clerk if this is within the division and has had the 2 hours requisite notice.
It is, Mr. Chairman.
Gentleman from Michigan is recognized.
Thank you, Mr. Chairman. And, we have many, many concerns with the bill, and one of the concerns that we have, too, is the way the bill is being sold. Matter of fact, the President of the United States kept telling the American people that, quote, if you like your plan, you can keep it, end quote. Just this week, he told the same thing to thousands of AARP members during a town hall. This is simply untrue. It's in the bill. CBO analysis also collaborates on that point. For seniors, this bill is bad news. It would cut over $150 billion from the Medicare Advantage program, virtually wiping out the market for those enhanced plans. But in addition, this bill cuts hospitals $160 billion, home health services $56 billion, skilled nursing facilities $32 billion, hospice $10 billion. This really goes after Medicare financing in a huge way. It's over $400 billion in Medicare cuts are in this bill. Over 10 million seniors are on Medicare Advantage, over 200,000 in Michigan alone. And when you ask, are seniors happy with their plan, as the President has asked, 88%, in fact, are. Medicare Advantage plans offer additional benefits and often have smaller co-payments and deductibles than traditional Medicare. While they're reimbursed slightly higher than traditional Medicare, that's because they provide seniors much more than traditional Medicare. And that's why millions of seniors are making that investment in that choice. This bill would gut an innovative program, and according to CBO, would force millions of seniors off of their Medicare Advantage plans. So clearly, it is inaccurate to say if you like your plan, you can keep it. In this bill, it says unless you're on Medicare Advantage, and unless you have a health care plan that's going to be now older than 5 years. Hundreds of millions of Americans are going to lose their private health care plan because of this bill. In addition, this specifically gets at those seniors, 88% who are happy with it, are going to lose their plan, millions of them, and 88% of them are, in the President's words, happy with their plan. My amendment is simple. It would require the Secretary to certify that no seniors will lose access to their current plan before cuts are made to Medicare Advantage. And with that, I would yield time. Dr. Burgess, did you have? No? Mr. Chairman, I would yield time to Mr. Gingrey of Georgia.
Gentleman from Georgia.
Mr. Chairman, thank you, and I thank the gentleman from Michigan for yielding. And I will have an amendment in a few minutes that speaks basically to the same thing. But when we are unable to currently fund Medicare, and the unfunded liability for Medicare is something like $35 trillion by the year 2075. That's how much in arrears we are in regard to funding the current Medicare program. And here we're going to slash Medicare benefits by hundreds of billions and cut Medicare Advantage to the bone. The gentleman's amendment, of course, speaks to protecting our precious seniors. And my amendment later on will do the very same thing. But to simply say that we will not allow these cuts to Medicare Advantage unless CMS can assure us that these seniors, some 11 million of them, 20% of people on Medicare, choose the Medicare Advantage program. Why? Because it goes a little bit beyond Medicare fee-for-service with that emphasis on wellness and prevention and callback and nurse practitioners in addition to a physician that essentially is a medical home. We talk about medical homes all through this bill. And here we're going to gut one very successful medical home that's currently in existence in current law, and in hope that something else that replaces it will work better. It makes no sense. I think the gentleman is absolutely right on target in regard to this amendment. I support it fully, and I hope members on both sides of the aisle will do so. And I yield back to the gentleman from Michigan.
Gentleman yields back. Gentleman from New York seeks time.
Just move to strike the last word. I'm just curious, and perhaps the author of the amendment can let me know, what is the pay for this? How are you offsetting it? Are you just adding to the deficit? There's $162 billion of savings that from eliminating this plan, which frankly doesn't kick anyone anywhere. Seniors still have access to Medicare. But surely, since we're all fiscally responsible here, you have some way to pay for this. Does the gentleman?
I'll be
glad to yield.
I mean, I would be delighted to go through our series of how you get to great health care reform if we ever had the opportunity.
Do you have any in this amendment?
And I would take the gentleman's question seriously, except for the fact that you say that somehow you're fiscally conservative on this issue. This is $1 trillion you really can't pay.
Reclaiming my time, I'll take...
And you're going to kick people off their plans to do it.
I'll take any one that you want to include in this amendment. I mean, frankly, this is a $162 billion tax that you're putting on the people of this country, because that's what it's going to come down to. That's how much this amendment is going to cost.
Would the gentleman yield?
I've already yielded once and wasn't terribly satisfied. The fact is that when you add this burden, this $162 billion burden over 10 years, I think it's the obligation of the maker of an amendment like this. And by the way, this money
Would the gentleman yield?
Just if you can just, it goes to insurance companies. And so this is $162 billion that you're taking from taxpayers to give to insurance companies. That doesn't seem like a very good deal. I mean, I, for one, and I think many of us over here, believe we should be reducing the cost to the government of health care. I believe we should be reducing the deficit, and this amendment would add $162 billion over 10 years. And it's not even that long an amendment. Imagine if you had more paper to work with. I mean, how much it would cost. This is 11 lines, $162 billion going to insurance companies. You know, I have to tell you something. We, on this side of the aisle, we now control the House and the Senate and the White House because the fiscal irresponsibility of my colleagues in the Republican Party had become so manifest. It's because of amendments like this. And by the way, the Medicare Advantage program was a giveaway to the insurance companies. That's been going on a while.
Would the gentleman yield?
Sure.
Well, first of all, this bill, according to the Congressional Budget Office, that you're talking about being so fiscally responsible, this bill is scored right now, even with your tax increases, as being $240 billion out of balance.
Well, let me,
Just last week,
if
you had
I can
amendments
reclaim,
that
because I
added-
get the gist of what you're saying. So you're saying it costs too much or it costs too little? Because this adds $162 billion.
Will the gentleman yield?
Maybe I've been misunderstanding the critique about the cost. Maybe all this talk about the cost is you don't think it costs enough. So you're going to offer amendments to add $162 billion like
the gentleman
that.
yield?
Will the gentleman yield?
Hold on, let me just finish my thought here. I thought that you were complaining that it costs too much. I see from this amendment that your complaint is that we should give more money to the insurance companies and hope for the best that they provide better health
If the gentleman would yield, we're not talking about giving anything.
$62 billion.
The bill takes away from senior citizens.
Wait a minute, the gentleman from New York, regular order, gentleman from New York has the time.
First of all, this be clear where this money goes. It goes to insurance companies. You're not giving $162 billion to our constituents. Don't kid yourselves. It's going to insurance companies, and you hope, you pray, you want insurance companies to pass that along. I'm curious, how's that been working out?
Will the gentleman yield?
Insurance companies been passing along a lot to people. How's that been working out?
Will the gentleman
Did it
yield?
work well in the Medicare Part D plan? No,
The
I don't think
citizens
so.
thinks it works
Did it
well.
work in Medicare Advantage? It's not working. Your strategy of dumping money to insurance companies' coffers is leading to one thing: insurance company profits. But now you're saying we want to bust the budget by having another $162 billion. We want to
Will the gentleman yield? Will the gentleman
yield to me?
To the maker of the amendment?
Who's going first?
Will the gentleman yield to the maker of the
Yeah, sure, I'll
amendment?
be glad to.
I see.
Mr. Rogers, regular order, Mr. Rogers,
I'll be glad to yield to Mr.
gentleman has yielded to the
And
gentleman
again,
from
it is
Michigan.
easy to see how, under my friend's control, they have gone from about $162 billion in deficit to $1.8 trillion with your kind of math and your
Okay,
action.
well, let me
But
just
let me
look,
ask you
can I
this.
say, hey, look,
It
if
doesn't
I can
add.
reclaim-
What you're
if I
doing
can
is we're
reclaim-
saying
if I can reclaim my time.
don't cut. Don't cut hospitals, home health services,
The
skilled
fact of
nursing,
the matter-
and seniors.
Regular order. Regular order.
Regular order. Look, the
Gentleman
fact
from
of
New
the
York
matter
has the
is
time.
that it's indisputable that this amendment would lead to $162 billion over 10 years going into the coffers of insurance companies. I know that that's consistent with your philosophy on governing. Give as much money as you can to insurance companies and hope for the best. But I think it's fiscally irresponsible. In addition to it being bad health care policy, it's fiscally irresponsible. That's not how we do things over here. I urge you to
Gentleman's
vote.
time has expired. As I understand, there's been 5 minutes on each side. It's the Republican side for the 5 minute. Mr. Lunt will control the remaining 5 minutes.
I thank the gentleman for yielding, and I'll yield to some of my friends here as we talk about this. Actually, if you want to talk about Medicare Part D, what we did in Medicare Part D was organize a system for the first time instead of operate a system. And, you know, my friend Mr. Weiner said that didn't work out too well. It worked out 40% cheaper than the lowest estimate, and now we're in year 4 or 5. It's still 40% cheaper, and people have lots of choice. A lot of these amendments are not about whether we don't want the government to help people get access to coverage. It's whether we believe that a competitive marketplace would produce higher quality and better price. And my sense of the gentleman from Michigan's amendment on this is it just addresses the president's pledge that if you like what you have, you can keep it. Our view would be if you cut that benefit, that assistance to rural areas and poor urban areas particularly, by this much money, people can't keep what they have. And my sense of the amendment is it's just exactly that. This would not allow people, if they like what they have now, to keep it, because they would no longer be able to afford to keep it because the assistance would be gone. There is a reason that Medicare Advantage is most used in poor rural and poor urban areas more than anywhere else in the country, and I think that's what this amendment's about. I'd be glad to yield to the gentleman from Oregon.
Thank you, Mr. Blunt. I appreciate that. I would just point out that in Oregon, 39% of seniors are on Medicare Advantage. We have the highest Medicare Advantage penetration rate. 210,000 senior citizens in Oregon's health insurance is at risk and at stake, depending upon the outcome of this amendment. And part of the reason they're on Medicare Advantage is Oregon has one of the lowest reimbursement rates, payment rates for seniors on a per-county basis, somewhere in the $400 range, half what it is in some of the big urban cities, maybe like, New York City, you think. And so, there's a reason, as my colleague from Missouri said, that these Medicare Advantage plans, while they may need some reform, abolishment is not the answer. Taking away seniors' health care is not the answer. And so I support the gentleman's amendment from Michigan. I return the time to the gentleman from Missouri.
I yield time to the ranking member, Mr. Barton.
Just want to make one comment. I haven't verified this, but I think I read this in National Journal several weeks ago. Over 40% of African Americans on Medicare on a Medicaid are on Medicare Advantage. If you're going to make the statement, if you have what you like, if you like what you have, you're going to keep it, then you ought to vote for this amendment. where Medicare Advantage is not offered everywhere, but where it is offered, it's the fastest growing option that is chosen. It has all the wellness provisions in it, all the preventive provisions in it. It's hypocrisy at its worst to say if you like what you have, you can keep it, and then gut the fastest growing part of Medicare, which is Medicare Advantage. So I would hope that we would accept the Rogers Amendment.
I'd yield time to the gentleman from Georgia, Mr. Gingrey.
And Mr. Chairman, I thank the gentleman for yielding, and just to further elaborate on what the ranking member said about who is advantaged by this program. Many of these Medicare Advantage programs are in rural areas of our country. In fact, I would expect that every blue dog on this committee on the other side of the aisle will be voting for this amendment. It seems like to me it ought to be part of the deal, the so-called deal that's been worked out. But in any regard, if it's not, this is a great opportunity for our blue dog friends on the other side of the aisle to support this. You know, it's really interesting that my friend from New York talking about the cost and the complaint by the Speaker of the House that CBO is not given proper credit in this bill for reducing costs by emphasizing wellness and preventive care. That's what Medicare Advantage is all about. So to say that it's a $160 billion cost, well, you know, maybe we do spend a little bit too much on Medicare Advantage, but the tremendous savings that you get in end-of-life treatment, in taking care of these people so that we emphasize wellness, completely ignoring that. So great amendment. I encourage my Blue Dog friends to support it, and I yield back to the gentleman from Missouri.
Mr. Chairman, looks like we're out of time, and we'll yield back.
Gentleman's time has expired. Mr. Stupak to control the last 5 minutes. And there are other members who want you to yield.
Mr. Chairman, I'll be brief so we can get some of the other members. But remember, Medicare Advantage came up in 2003. What do you pay on Medicare Advantage? For every dollar you pay on Medicare Advantage, you either pay $1.05 or $1.19. So when we're paying that much excessive money, why should only 40% of the seniors have it? Why don't we give it to everybody? But we can't because we're trying to be fiscally responsible. I have Medicare Advantage in my district, and I told the seniors we're going to all get reimbursed the same thing. No insurance company is going to get an extra 19 cents on the dollar compared to everybody else. They should be putting that extra money into care and quality for seniors. They don't. It goes into pocket. It goes into pockets. When we talked about the last amendment, the unscrupulous tactics and abusive tactics they use to sign seniors up on Medicare Advantage, and no state can do anything about it because of the preemption law that was in the 2003 Medicare Advantage law, the insurance commissioners, Democrats, Republicans, told us, why do they do these tactics? Because the broker, the salesperson, gets an excessively high commission. The money in Medicare Advantage, the $1.19 per every dollar in Medicare, goes in the pocket of the insurance companies and these brokers and agents. Look, this is equal and fairness, and what we do in this bill is over 3 years, we phase out. We don't take away anyone's insurance. We take out the excessive profit in Medicare Advantage and say you're all going to play by the same rules. Provide a quality product to all of our senior citizens at the same rate. No more Medicare Advantage. No one gets a little extra money to put in their pocket or in the insurance companies. We're all going to play by the same rules.
Well, the gentleman...
No one's policy is being taken away. We're going to all be paid the same amount. So whether you're in northern Michigan, Florida, or Georgia, wherever you are, you play by the same rules.
Gentleman, yield.
I'll yield to Mr. Green.
Thank you, and I won't take up any more time than we can. But my colleagues on the Republican side, you can't have it both ways to say Medicare is going to go broke in 2 years and yet continue to pay those high percentages for less than 20% of the population under Medicare. That's why in 2003 it was wrong, and it's wrong today.
Will gentleman yield?
No, I won't yield. We only have a brief amount of time. 80% of the Medicare recipients around the country get it through straight line, regular Medicare fee-for-service. May not be true in Oregon, but I know in a very urban area we have a lot of seniors on Medicare Advantage, and it's great. The problem is that I have 80% of my constituents who are on Medicare regular line Medicare and you want to do it. You can't do that. We plussed it up so much, and we know where the money's going. It's not going to the seniors.
Sure.
They actually want to insure the healthiest seniors, so that's what they're doing, and they're paying high percentages. So it's going into insurance companies' profits. I want that money to go into Medicare to pay doctors, pay hospitals for our seniors. And I thank my colleague for yielding.
Ms. Schakowsky, I'll yield.
Thank you. In Illinois, we have very few people actually who are the Medicare Advantage plans, but they're concerned about it too, because actually $2 to $3 a month is what they're paying for those who are enjoying Medicare Advantage plans. You think that that money just appears in order to pay 119% of Medicare rates? No, it comes out of the pockets of other senior citizens who are seeing their rates go up. The other thing, you know, we've heard a lot from the other side about level playing field in any kind of a public option. Oh dear, there might be some advantage to a public plan. And now you're here today arguing that we should give special advantage to this kind of a private health insurance plan that my seniors who do not use that kind of plan are paying for every single month. It's just not fair, and it's not a level playing field.
You want to yield?
Reclaim my time. I'll yield to Mr. Inslee.
Thank you. I'm sensitive to this issue because in a lot of the very low cost reimbursement states like Washington, people are using Medicare Advantage to try to make up for the deficiencies. But we are going to have a solution to that problem that will be in the bill before it gets to the floor of the House of Representatives. We have also been working with the Speaker to fashion a way for some bridge for the areas that will be affected by the Medicare Advantage changes. And I am quite confident that a combination of those efforts will help ameliorate these problems and do it in a way that will cut costs. We are going to have, by the time this bill is on the floor, a cost containment system that will go into effect after a study by the Institute of Medicine that is going to help fund a solution to this problem. So this is not the end, this is just beginning. We're going to find a solution to it. It's not going to be this one. Thank you.
All time has expired on this amendment. Vote now occurs on the Rogers amendment. All those in favor say aye. Aye. Opposed, no.
No. Mr. Chairman, we'd like a recorded vote.
Okay, let's go to a recorded vote.
Mr. Waxman.
No.
Mr. Waxman votes no. Mr. Dingell. Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone, no. Mr. Gordon. Mr. Rush. Ms. Eshoo. Ms. Eshoo, no. Mr. Stupak. Mr. Stupak, no. Mr. Engel. Mr. Green. Mr. Green, no. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Ms. Harmon. Ms. Harmon, no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. No. Mr. Gonzalez, no. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Matheson, no. Mr. Butterfield. Mr. Butterfield, no. Mr. Mélenchon. Mr. Mélenchon, no. Mr. Barrow. Mr. Barrow, no. Mr. Hill. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes. Mr. Sarbanes, no. Mr. Murphy of Connecticut. Mr. Murphy, no. Mr. Space. Mr. McNerney. Ms. McNerney, no. Ms. Sutton. Ms. Sutton, no. Mr. Braley. Mr. Braley, no. Mr. Welch. Mr. Welch, no. Mr. Barton. Mr. Hall. Mr. Hall, aye. Mr. Upton. Mr. Stearns. Mr. Deal. Mr. Deal, aye. Mr. Whitfield. Mr. Whitfield, aye. Mr. Shimkus. Mr. Shadegg. Mr. Blunt. Mr. Blunt, aye. Mr. Boyer. Mr. Boyer, aye. Mr. Radonovich. Mr. Radonovich, aye. Mr. Pitts. Mr. Pitts, aye. Ms. Bono Mack. Ms. Bono Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, aye. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick, aye. Mr. Sullivan. Mr. Sullivan, aye. Mr. Murphy of Pennsylvania. Mr. Murphy, aye. Mr. Burgess. Mr. Burgess, aye. Ms. Blackburn. Ms. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Scalise. Mr. Scalise, aye. Mr. Gordon. Mr. Gordon votes no. Mr. Ross. Mr. Ross, no. Mr. Hill. Mr. Hill, no. Mr. Doyle. Mr. Doyle, no. Mr. Markey. Mr. Markey votes no. Mr. Dingle. Mr. Dingle, no. Mr. Space. Mr. Space votes no. Mr. Engel. Mr. Engel votes no. Mr. Upton. Mr. Upton is aye. Okay, right.
Have all members responded to the call of the roll? Mr. Barton, how do you wish to be recorded?
Mr. Barton votes aye.
Anyone wish to be recognized to change his or her vote? If not, we close the vote, and the clerk will tally the vote. Are you ready with the result?
We are. Mr. Chairman, on that vote, there were 20 ayes and 34 noes.
20 ayes, 34 noes. The amendment's not agreed to. Who is next? Mr. Weiner? Mr. Weiner, you have an amendment you wish to offer?
It's A, actually.
Clerk have the amendment?
Yes, sir.
Is it qualified?
Yes, sir. It's timely and to Division B.
Okay. Without objection, the amendment will be considered as read. The gentleman from New York is recognized to offer his amendment.
Thank you, Mr. Chairman. This amendment seeks to clarify one of the great enduring mysteries of the debate about health care, and that is where my Republican friends stand on the issue of government-run health care. Now, on one level, it's very clear. Quotes throughout the debate have seemed to imply that they're against it. Mr. Stearns of Florida said, if the government runs it, it will be bureaucratic and efficient. Many cases will not cover the people who want it. Mr. Terry of Nebraska, government-run health care will lead to rationing, eliminate the sacred doctor-patient relationship. Mr. Blunt said on health care reform, the marketplace is the only known mechanism available to deliver what people want. Now, I raise this subject because today is the 44th anniversary of President Johnson signing the Medicare Act into law. Now, the Medicare Act, as all of my colleagues know, is not only government-run health care, but it's remarkably good government-run health care. Now, I was criticized earlier for having shoddy charts, so I got a little fancy. On this chart, you see that not only is Medicare public health care, but also we have DOD, Veterans Affairs, and Indian Health Service. Now, this is not only government-run health care, but it's remarkably efficient. 3% overhead in Medicare, compared to about 30% in the combination of overhead and profits by the health insurance companies. Remarkable satisfaction on the part of the contractors. In the last national scoring that they did of the contractors, it got a 4.1 on a 6-point scale. And frankly, we know it works. We know that when Medicare, before Medicaid was passed, we had a poverty rate of seniors of about 30%. Now it's about 10%. We know also that the private insurance companies take about $600 billion a year and put it in their pockets, not into health care. Now, some people have held up this chart, this Byzantine chart, that talks about how they think the bill works. Well, I've got my own chart. This is Medicare. 3 boxes. The patients, the doctors, and the one single payer. So this amendment is simple. It gives my Republican friends the chance they've been waiting for to vote against government-sponsored, government-run, government-administered health care. It's your dream amendment, unless, of course, you're going to continue to do this Sybil impression when it comes to Medicare. First you like it, then you don't like it, then you like it, then you run against it. The fact of the matter is that Medicare is a pretty darn good model of what a public plan might look like. Now, it's not perfect. There are reimbursement rates in some cases I think need to be higher. I think we incentivize too much to go into hospitals and not enough on the other side. Some of the things that are being done in this bill. But this is your opportunity, once and for all with my amendment, to vote to eliminate the Medicare Act. Once and for all, stamp out the scourge of public, government-run, government-administered, single-payer health care. This is your chance. And you know what? For all of the talk about how much you hate such programs, I think you'd welcome this opportunity. Now, I'm going to vote no, and I'll tell you why. Because I think the Medicare program works pretty darn well. I think it's administered efficiently. I think that you ask seniors, if you tell someone tomorrow who's 55 years old, you're going to get Medicare, that we're going to start covering people 55 to 65, and then maybe 45, and then 35, and who knows, maybe Medicare for everyone, you'd have a lot of people who would be pretty happy. There have been a lot of elements of this debate that have been hard to follow. I admit that. But one of the hardest has been the utter hypocrisy and contradiction inherent in the arguments of many of my friends on the other side. This is put up or shut up time. If you don't like national health care, if you don't like government-run health care, this is your amendment. I dare you. I double dare you. Vote yes on this. And then go home and explain to your constituents how you're so philosophically opposed to publicly funded health care that you voted to eliminate Medicare on its 44th anniversary. And let me just say this, since I only have 27 seconds left. There's one member here who voted in favor of Medicare when it was created and who was present when it was signed 44 years ago. And on behalf of all of us, I want to say publicly, I want to thank him for being there for us 44 years ago when it was signed, and God willing, he will be here to watch this be signed, where we extend another example of efficient, sound, publicly funded, publicly administered health care. And I yield back my time.
Gentleman's time has expired. Mr. Barton?
Parliamentary inquiry, Mr. Chairman.
Gentleman will state his parliamentary inquiry.
Is there a requirement that the sponsor and author of amendment has to vote for it?
It's the usual practice in my experience.
Okay. Then I will double dog dare the author of the amendment to put his vote where his mouth has been for the last 5 minutes and vote for it.
Well, can
It
I
ought
be heard on the
to get
parliamentary
one
inquiry,
vote.
Mr. Chairman, may I be heard on the inquiry?
Because my guess is it's going to get zero.
Wait. The gentleman's made a parliamentary inquiry, and now you're making a speech.
Well, I also want to speak on my own time.
Okay. Did you wish a parliamentary
I'll be
inquiry?
happy to.
No.
Wish to be heard on the before the chairman rules on the parliamentary inquiry. I wish to be heard.
Well, the chairman is certainly not going to rule on it. The chair does not know of any rule that requires the author of an amendment to vote for it. Let me recognize Mr. Barton, but if you'll allow me, in celebration of the fact of the, is it 44th anniversary of Medicare becoming law?
And the first Medicare card went to President Truman.
We have pizza in the back for both the Democrats and the Republicans to celebrate this occasion, and I just want the members to know that, because if you see people eating, you'll know why they're eating. But we're going to continue the markup.
Mr. Chairman, may I ask a procedural question?
Procedural question. You have to eat it with your finger.
Are we still operating under the rule of 5 minutes on each side?
We are, but we haven't started the 5 minutes for.
So 5.
Yes.
Okay, thank you.
Mr. Barton, for your 5 minutes.
I rise in opposition to this particular amendment. There is a distinction, and I'm going to treat the amendment seriously. Okay, there is a distinction between a government mandate and a government-run plan. Medicare is a government mandate. There are numerous government mandates and government entitlements. Having said that, the Congress sets the requirements of Medicare, and then the executive branch issues regulations to implement those requirements. To my knowledge, at least in my part of the country, Medicare is operated by private companies under contract to the federal government. We have never, on the Republican side of the aisle, said that we oppose, at least in this Congress, in this committee, that we oppose Medicare. My mother would not be alive today if it weren't for Medicare. She had a heart condition several years ago that was very difficult to treat. She went into Houston to the Herman Hospital Heart Center and underwent a 2-part surgical provision that basically replaced her aorta. And it was very complicated. It cost over $100,000. She paid out of pocket less than $500 because of Medicare. You're never going to hear the ranking member say that he opposes Medicare. But what we have tried to do when we were in the majority, we have tried to use a market system within Medicare. Medicare Part D, the prescription drug benefit, depends upon market competition that numerous private sector drug insurance plans offer their services, and senior citizens choose which, if any, of those plans that they want to get their prescription drug coverage for. We use a market orientation to implement a government mandate. That is a far cry from saying that we oppose Medicare because it is a government mandate. So, with all due respect to my friend from New York, you know, if he wants to eliminate Medicare and he wants to eliminate Part A, B, C, and D, let him vote for his amendment.
Will the gentleman yield for a question?
I'll be happy to yield for a question.
If the public plan under the initiative that we're considering today looked like Medicare, would you support it?
I didn't hear the...
If the public plan under that's being contemplated in this bill looked like Medicare, would you support it?
We are working on several options of co-ops and pooling arrangements. One Mr. Shattuck is offering. Mr. Boucher is working on a plan. If we could get something like that, we very well might support it. I want to yield to the Deputy Ranking Member.
I thank the gentleman for yielding. I thought the ranking member's point was well made, that the difference in this debate is Medicare is a mandated program that everybody goes to without options, without competition. If Medicare, a Medicare-like plan that paid on average 80% of what is supposed to be the cost of health care was out there, certainly it would be appealing because it's not paying the entire bill. Why do there are many doctors that won't take Medicare patients. We'd like to see a system, I'd like to see a system where we assisted everybody into health care coverage, and I don't want everybody to have doctors they can't go to. The ranking member made a point about in trying to expand the benefits of Medicare to Part D, as I said earlier, for the first time ever, instead of trying to operate the system, we put a system together there where marketplace forces did work. It's cheaper than anybody thought it would be by 40%. It's a voluntary plan that 90% of the people that could be in the plan are in the plan. 90% of them think it's either good or excellent, and 100% of them can change their provider sometime in the next 12 months. Those would be good things available to people in health care, whether they were on Medicare or not. I said on the other day, I mentioned that Medicare had not been particularly good at helping people prevent health care problems from developing. And in fact, until 2005 or 6, when the Medicare reforms were initiated, no Medicare patient from 1965 until then had ever seen a doctor unless they were sick. Had ever seen a doctor unless they were sick, or they thought they were sick and got to the doctor accidentally. It was our reforms to Medicare that created the Welcome to Medicare physical, where for the first time ever in the entire history of the program, people saw a doctor when they entered the program, and they got their blood pressure, they got all of those things, created a baseline that helped them be well longer in a more effective way. We have not only supported the program, we have worked to improve the program, and we'll continue to do that. And I think our time,
Gentleman's time has expired. Who seeks recognition for the second 5 minutes? Are we ready for the vote? Well, it's Democratic time. Mr. Butterfield is recognized for 5 minutes.
I strike the last word, Mr. Chairman. I ask to strike the last word.
Would the gentleman yield?
The gentleman is recognized for 5 minutes.
I yield, Mr. Weiner.
I guess the failure to answer my question speaks volumes. The fact of the matter, you like Medicare, right? Because it's efficient. It's not bureaucratic. It's efficient. No one dispute that, okay? You like Medicare. Now, the whole idea of Medicare is that it is government-run health care. It's socialized medicine. It's what it is. And you know what? It works. One of the reasons it works is the $600 billion of profits that we put in goes not to checkups, not to care for indigent people, not for preventive care. It goes to profits for the healthcare companies. So much so that their administrative overhead, combined with their profits, is 30% compared to 3% for Medicare. So you like it. You're not going to vote for this amendment because you like Medicare, and you go home to your constituents and brag about how you fought to save Medicare. That's socialized medicine. I just want to stop the hypocrisy of having you all stand up as frequently as you do and lament socialized medicine. Bureaucrats coming between you and your doctors. Hey, can I tell you something? Do you think there are no HMO bureaucrats? No insurance company bureaucrats?
Will the gentleman yield?
Let me just finish. I don't control the time. But when I said, what if the public plan looked like Medicare, I didn't hear an answer. You like it? Well, maybe the public plan in here is going to look kind of like Medicare.
Would the gentleman yield?
Like Medicare? Hold on a second. Hold on. Let me just finish this thought. Because if it is, it's going to be more efficient. Now, you have said repeatedly, we have to be careful because you're going to, if you let that be an option, the private plans won't be able to compete. Now, that's a strange thing to say. Do you mean that the public may choose something like Medicare over your friends in the insurance industry? Yeah, they might. You know why? Medicare does a better job. People like it. So when you stand up and say socialized medicine, government-run medicine is bad, implicit in that is Medicare, the VA, and DOD healthcare, which are government-run healthcare plans. So when you think about the public plan and you go home and say how bad it is, you're essentially saying you don't like Medicare.
Reclaiming my time, I yield to the gentleman from Missouri.
I thank the gentleman for yielding. And you did hear an answer. You heard the answer was when we talked to our health care providers where we live, they say that Medicare does not pay the bill, and that has to be either by charitable donations or by other plans, has to be supplemented. That's one of the reasons that the reimbursement rate from the private plans is higher than the Medicare plan. That's one of the reasons they cost more. That's one of the reasons that the more people that go into a government-like plan, the harder it is for those plans to compete. And when we talk to our hospitals and doctors, I think the nationwide average is that the Medicare reimbursement rate is right at 80% of what health care providers say is cost of service. Now,
the gentleman yields for a moment. But the point being made here is not whether or not Medicare is perfect. I know that it's not. The point is the language of criticizing government-run health care is hypocritical and dishonest. You can't have it both ways.
I still have Mr. Butterfield's time.
Mr. Butterfield, would you
let me.
The gentleman from Missouri has the time.
Go in 5 minutes.
Gentleman from Missouri has the time.
I thank the gentleman for yielding, and I will just try to answer the question and get the time back to your side, Mr. Weiner. The point is, if you have more people in a system that doesn't reimburse cost of care, who does reimburse? And I'd yield.
Well, the answer is the 15% that goes to profits goes back to reducing costs.
Well, I don't know.
Why is it? I'm curious. You know, the idea that the health insurance companies are keeping prices at a certain level out of altruism. No, they're making profits. Why are we putting money into the profits of insurance companies rather than into medicine? It makes no sense. Now, Medicare doesn't do that. That's why Medicare is such a success, and that's why you wouldn't deign to criticize that as being government-run health care. You like it. You think it's good. It's better in many cases. You have a 30% combined overhead. 15% of it is profits. By the way, how much profits? Here, I'll tell you how much profits. $600 billion, approximately $600 billion, and that's on the rise. So the question is, why don't we capture some of that money and put it towards health care? You like Medicare, you like socialized medicine, you like government-run health care, and you're just afraid to admit it.
Will the gentleman yield? I can reclaiming my time, Mr. Chairman. I yield back.
Mr. Chairman, I'd like
The gentleman yields back the balance of his time. Mr. Murphy.
Thank you, Mr. Chairman. This is not the place to have sweeping prejudicial statements about whether people are hypocritical or dishonest. Let's stick with some facts. New York Presbyterian Hospital, of 93 internists affiliated with that hospital, 37 accept Medicare. A MedPAC survey in 2008 said 29% of patients on Medicare have trouble finding a primary care doctor. That's up 5% from the year before. In the last Congress, there was 452 bills introduced by members of Congress. 13,000 co-sponsors of those saying, we have problems with Medicare and Medicaid. Let's fix them. Only 12 were signed into law. But it takes an act of Congress to change government-run health care. There is a lot of good things with Medicare, no doubt about it. But let me give you some examples where you have procedures that require an act of Congress. In order to get intravenous drugs, patients must enter a hospital, although the therapy can be given at home. It's going to take an act of Congress to change that. You have situations where Medicare might not pay for a power wheelchair for an individual with severe arthritis who can walk a short distance, but who may need a power wheelchair for a longer distance outside the house, but a private insurer might pay for that. Medicare HMO enrollees may not be able to afford cancer clinical trials because the Medicare doesn't adequately cover costs. You have situations where a patient can be transferred by a wheelchair van. Medicare won't reimburse for transportation by an ambulance, but if they take a wheelchair van to a hospital, Medicare won't reimburse it.
With the gentleman?
No, not yet, because I don't want to be hypocritical. I want to give you facts. There's also issues where you have situations where some patients require very expensive over-the-counter medications, but it's cheaper than prescription drugs, but they can't get reimbursements for it. My point is this. The concern is not, and let's not create this straw man of sweeping generalizations that we don't like Medicare or government-run programs. The problem is between your doctor and you is Congress. And what we see in these things is many inefficient things that over the years. Now, what I would suggest we do is recognize there's a lot. Could you sit down, please? There's a lot of great things happening in Medicare, but it really needs to be reformed. 44 years ago, it was made. It hasn't gone through reform since. And I think one great thing this committee can do is really spend some time going through that. I would love it if the president would appoint a blue ribbon panel and say, let's fix this program and find all the good things in it, take out the other things. So, and you have inefficiencies and ineffective things in Medicare, Medicaid, and other elements there as well. So,
Dr. Murphy,
I would suggest those. I would yield.
Gentleman yield.
Yes.
I'd just like to make this point. It doesn't happen very often, but every once in a while, I guess as members, we get to vote on amendments that are truly a political farce. And that's what this amendment is, and it's unfortunate because the author of the amendment is not going to vote for it himself. Now, one thing I would like to note is that when as you celebrate this anniversary of Medicare, please note the numbers I'm about to give, I also gave when Republicans created Medicare Part D, and you were making these allegations even back then that Republicans, how could you be doing this? You don't even like Medicare. So I'm going to repeat them today. When the bill passed the Senate, when Medicare was created, the vote was 77 to 21. And in the House, to pass Medicare, the vote was 355 to 59. So please, and it was passed by a Democrat control. Sir? Well, I tell you what, Mr. Weiner, I would love to have conversations with you, but I don't have the patience for you to be an intellectual smarty, okay? The point here is this was a bipartisan vote. Mr. Weiner, it was a bipartisan vote. And you know what's going to happen here is, are you going to vote for this amendment, Mr. Weiner? I'll yield to you. Well, I'm going to yield back to Dr. Murphy. The farce continues.
Mr. Murphy, would you yield to a question?
For me?
Yeah. I mean,
let me give it to some of my colleagues that haven't spoken. Mr. Scalise.
I want to thank the gentleman from Pennsylvania. You know, you can beat up on insurance companies all day, and you know, some people might make a career out of that, but you shouldn't beat up on senior citizens. If you wonder why so many seniors are concerned about this government takeover, it's because this bill cuts over $500 billion out of Medicare. And so you can talk about how good Medicare is. A lot of us think Medicare's got a lot of good components, could surely use some reforms, but you shouldn't go and cut $500 billion out of Medicare like this bill does. So go beat up on insurance companies all day, but don't try to stand on the backs of senior citizens to make your point on this bill. If you can't sell this bill on its own merits, don't try to hide behind senior citizens to do it. I yield back to my friend.
All time has expired. The vote now comes on the Weiner amendment. Those in favor say aye. Those opposed, no. No.
Mr. Chairman, I'd like a roll call vote on that.
The noes have it.
I request a roll call vote.
Clerk will call the roll. You want to show of hands?
No, I want to vote.
Okay.
I'm going to put everybody on record on this. He offered it. He's going to get to vote for it or against it.
Mr. Waxman?
No.
Mr. Waxman votes no. Mr. Dingle? Mr. Dingle, no. Mr. Markey? Mr. Boucher? Mr. Pallone? Mr. Pallone, no. Mr. Gordon? Mr. Rush? Ms. Eshoo? Ms. Eshoo, no. Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Engel, no. Mr. Green? Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Mr. Doyle, no. Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow, no. Mr. Hill? Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy, no. Mr. Space? Mr. Space, no. Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton, no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch, No. Mr. Barton? Mr. Barton votes no. Mr. Hall? Mr. Upton? Mr. Upton, no. Mr. Stearns? Mr. Stearns, no. Mr. Deal? Mr. Deal, no. Mr. Whitfield? Mr. Whitfield, no. Mr. Shimkus? Mr. Shimkus, no. Mr. Shattuck? Mr. Shattuck, no. Mr. Blunt? Mr. Blunt votes no. Mr. Boyer? Mr. Boyer, no. Mr. Radonovich? Mr. Radonovich, no. Mr. Pitts? Mr. Pitts, no. Ms. Bono-Mack? Ms. Bono-Mack, no. Mr. Walden? Mr. Walden, no. Mr. Terry? Mr. Terry, no. Mr. Rogers? Mr. Rogers, no. Mrs. Myrick? Mrs. Myrick, no. Mr. Sullivan? Mr. Sullivan? Mr. Sullivan, no. Mr. Murphy of Pennsylvania? Mr. Murphy, no. Mr. Burgess? Mr. Burgess, no. Ms. Blackburn? Ms. Blackburn, no. Mr. Gingrey? Mr. Gingrey, no. Mr. Scalise? Mr. Scalise, no. Mr. Boucher? Mr. Boucher, no. Mr. Markey? Mr. Markey, no. Mr. Rush? Mr. Rush, no. Mr. Hill? Mr. Hill, no. Mr. Matheson? Mr. Matheson votes no. Mr. Green? Mr. Green, no. Mr. Gordon? Mr. Gordon votes no. Is he here? Okay.
Have all members
Okay.
responded to the vote?
I got everybody over here? Let's see.
Any member wish to change his or her vote? When the clerk's ready, we'll get a report of the vote.
Mr. Chairman, on that amendment, there were 0 ayes and 57 noes.
0 ayes, 57 noes. On a bipartisan basis, the amendment is rejected.
Yeah, and Mr. Wiener's got nowhere to go but up on his next amendment.
Okay. Mr. Deal, you have an amendment.
Yes, Mr. Chairman, I have an amendment. It's ECR 170.
Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute offered by Mr. Deal of Georgia. Add at the end of
Without
subtitle
objection,
C.
the amendment will be considered as read. The gentleman from Georgia is recognized for 5 minutes.
Thank you, Mr. Chairman. This is an amendment that deals with an area that I think everyone recognizes is one of the most expensive portions of our healthcare system, and one that unfortunately is dealing with healthcare situations that are not warranted, and that is the emergency rooms. As I'm sure everyone knows, the Emergency Medical Treatment and Active Labor Act, we commonly refer to as EMTALA, requires emergency rooms to accept individuals for treatment, basically without regard to their medical condition. The result is that most emergency rooms are seeing a predominance of individuals who do not present themselves with what are emergency health concerns. In fact, in the hospital that is in my hometown, and is probably typical of hospitals in most of your hometowns, the number one presentation at the emergency room is an ear infection, which does not, under most people's definition, meet that of an emergency. The cost in an emergency room are significantly higher
than the cost of treating these kinds of problems in a doctor's office or in a health clinic. Now, what this amendment does is it says that if an emergency room doctor has conducted an appropriate screen of the individual who presents themselves, and that screening indicates to the doctor that the condition of the patient is not an emergency and therefore is not appropriate.
Mr. Chairman, the committee is not in order. I can't hear what the gentleman is saying. And
the committee will
each
come
one
to
of
order. The
speaks deserves to be
gentlelady's
heard.
point is well taken. Committee will please come to order and give respectful attention to the speaker.
Thank you, Mr. Chairman. Thank the gentlelady. What this says is that if after a proper screening is done, if the individual does not meet an emergency room requirement, but could be treated at an alternative site, a doctor's office or a clinic or some other facility, that the doctor who makes that determination after the screening would be afforded the same protection as we afford to doctors who work in community health centers. Namely, they would have the protection would have the protection of the Federal Tort Claims Act. And the Federal Tort Claims Act, of course, would simply say that here, this emergency room doctor who's gone through these procedures of screening would have that same protection as if he were working in a community health center. Now, what effect will this have? It, first of all, will have the effect of reducing a significant cost in the healthcare delivery system. It primarily will affect the Medicaid programs. States and the federal government are paying rather high bills for non-emergency services rendered in ERs. I think this is one of the steps that we can take in a common sense effort to try to save money and at the same time provide the kind of care that is most appropriate for the condition with which an individual presents themselves. We're forcing the hospitals and the emergency room doctors by EMTALA to treat these individuals even though they don't meet the criteria that EMTALA was originally designed to cover. I would urge the serious consideration of the amendment, and I would hope that my colleagues would see fit to adopt it. And I will yield to anyone on my side. I yield to Dr. Burgess.
I want to thank the gentleman for bringing this amendment forward. What most people don't realize, we've spent the last several weeks talking about individual mandates and employer mandates. There exists right now a provider mandate for every doctor who is on an active medical staff or who covers an emergency room that they must perform under EMTALA, as Mr. Deal has outlined. One of the big problems is getting doctors on the staff to be able to want to cover an emergency room, and therefore you have doctors who are leaving active medical staff privileges, who are going to alternative sites to practice where they won't be exposed to having to cover an emergency room precisely because of the very high liability climate. This is a small step we can take toward neutralizing that activity and making the provider environment just a little bit more friendly in our nation's emergency rooms. And goodness knows we need the surge capacity of all of those doctors who are on the medical staff to be willing to cover emergency room patients. This is a sensible amendment. I suspect the cost is extremely low, and it is something that we should get behind and do for our nation's doctors. So I'll yield back to the gentleman from Georgia.
The gentleman's time has expired. Who seeks recognition? Mr. Braley.
Thank you, Mr. Chairman. I think one of the things that many people don't understand about the way many emergency rooms are staffed in this country is that much of the care is provided by locum tenens physicians who aren't actually employed by the hospital and don't have regular full staff privileges to provide emergency care. They work for a various number of hospitals in different settings, and that has an impact on the ability for that hospital to provide the necessary discipline when bad practices are occurring. One of the things that I am concerned about is that this overly broad amendment would take accountability off the table for screening done by medical providers of emergency services and have the government assume fault for any negligence that occurs in the screening process. This is a way of shifting the burden from the responsible party, the physician staffing the emergency room, to the taxpayers of this country. That's what the Federal Tort Claims Act is set up to do. And that's one of the things that I thought was supposed to be the hallmark of our friends on the other side is embracing the concept of accepting personal responsibility when you make mistakes that injure or kill people. One of the things that we know is taxpayers will end up footing the cost of medical malpractice under this amendment. The proposal also lowers the standard of care for uninsured patients. It lowers the standard for medical screening services, and unlike doctors who are employed at VA hospitals or by federally funded health centers who are actual government employees, the government will have no authority to punish or provide additional medical training to private medical providers who provide care below the accepted standard. This amendment encourages hospitals and emergency providers to dump patients at other hospitals. EMTALA was enacted by Congress to ensure that uninsured and Medicare patients would be provided thorough emergency medical care before being transferred to other facilities. This amendment makes provisions so that it is easier for providers to determine that no emergency medical condition exists, allowing them to quickly transfer patients to the facility providing for poor and uninsured patients, and it does not specify where those patients are going to be referred to. And the whole point of this bill that we're debating is to provide access to primary care, which will reduce the burden on our hospital emergency rooms by making sure that patients have access to primary care. And that's why there's no reason to single out emergency room physicians for special treatment. There's also a little thing that's called the Seventh Amendment that every member sitting here today swore to support when they took the oath of office. And the Seventh Amendment says that in suits at common law, which is what a medical malpractice case is, that in amounts and controversy $15 or more, the right to trial by jury is inviolable. That constitutional right in the Seventh Amendment will be abrogated by the amendment that we're talking about. And that's why members need to know that they threaten violating their oath of office by voting to support this deal amendment.
Gentlemen, yield to me.
I'd be happy to yield.
There was a comment made by our colleague and friend from Georgia that we
Dr. Kingery.
We let this federal government take over the liability for people at community health centers, and Mr. Pallone's amendment made that law consistent for the employees, the volunteers at the center. They would be covered under the Federal Tort Claims Act. But in contrast, the Deal Amendment would give the Federal Tort Claims Act protection to doctors at private hospitals. These doctors are either salaried staff or contract employees. They're not volunteers. They have private insurance. It makes no sense to shift costs away from private insurers to the federal government. Letting doctors off the hook for emergency room screening only encourages patient dumping for patients truly in need of emergency services. So I would urge opposition to
Mr. Chairman. Mr. Chairman, gentleman yield.
Gentleman from Iowa has the time. Do you wish to yield it to some of our colleagues on the Democratic side?
Mr. Chairman. Thank you, Mr. Chairman, and I appreciate his statements, because what was in the Chairman Pallone's amendment was something that Congressman Murphy and I had worked on for volunteers at federally qualified health clinics. We're not talking about volunteers in the hospital emergency room in a national emergency. This amendment goes much further than that. And I think, Chairman Deal, if you would work with some of us over a period of time, we'd like to work with you on it, because I have no problem with having doctors divert people who are non-emergencies from emergency room. And again, like my colleague from Iowa said, there's this provision, there's no protection there. I want them diverted to a community-based health clinic or to a 24-hour clinic so they can go there without sitting 6 hours and waiting to see a doctor. So,
Mr. Chairman.
Gentleman's time has expired. Who
Thank
seeks
you.
recognition?
I do, Mr. Chairman.
Shattuck, you're recognized for the 5 minutes.
Thank you, Mr. Chairman. I think this amendment and the debate we've just had illustrates the fundamental misunderstanding, indeed the shocking lack of understanding and perception of how EMTALA works. EMTALA works just like, in many ways, a federal health care clinic, only the doctors who fulfill the responsibilities under EMTALA don't get paid at all. Doctors, as Dr. Burgess explained a little bit earlier, because they're on the staff of a hospital, are required to pull hours in the emergency room. Often they're not paid for that. In the old days, they did that so that they could get paying patients later in their own practices. What EMTALA says, and quite frankly, we're going to talk a minute about constitutional takings, what EMTALA says is that those doctors and those hospitals must provide care for free. Indeed, the way EMTALA works, it orders all hospitals and all doctors to provide that care and not to be able to determine in advance if they'll ever be paid. That is, if you want to talk about the 7th Amendment, let's talk about the 5th Amendment. The 5th Amendment says you cannot take property without due process of law. And yet EMTALA orders doctors and orders hospitals to provide free care. How many of us in this room are ordered by the federal government to provide whatever it is we sell for free or whatever it is we do for free and just commands us to do it? That's exactly what EMTALA does. Now, you may say that's good public policy so that people get care, but the absolute least the government could do is cover their liability when they provide their care. And that's what Mr. Deal's amendment does. Mr. Deal's amendment says when a doctor is compelled under EMTALA to provide care, by definition to provide it for free, unless they're paid by the hospital, as in the example that Mr. Sutton spoke about, because they're on the hospital staff, in which case the hospital is providing it for free, we're forcing them to give that care for free. The least we should do is cover their liability. That is what Mr. Deal is saying. He's simply saying when we force a doctor or when we force a hospital to provide care to someone because we as a society think they ought to be able to get free care in an emergency room and not bleed on the street or not go without care, then we, the government that forced them to provide that free care, ought to cover their liability. I think the Deal Amendment is fundamental fairness for every doctor and every hospital in America. I urge my colleagues to support it. And I'd be happy to yield to Dr. Gingrey.
Well, I thank the gentleman for yielding, and I want to refer back to some of the comments that the gentleman from Iowa made in regard to emergency room physicians. And it may be true in rural Iowa that many of these emergency room physicians are locum tenens. Locum tenens basically means filling in for somebody on the weekend. But the suggestion that most of emergency room physicians are of that description is blatantly untrue.
Would the gentleman yield?
If the gentleman will let me finish making my point, I'd be glad to yield back, and maybe the gentleman from Arizona will yield to you. But most of these physicians are specially trained, 3 years of training after medical school. Some even have general surgery training. So they're well-qualified physicians, and certainly what Mr. Deal is suggesting I think makes great sense. These patients are not abandoned in the emergency room. They are seen, they are triaged, a determination is made that they are not, they shouldn't really be in the emergency room. Their situation is not an emergency, and they have patients there that are waiting who are having heart attacks, or maybe they're suffered a gunshot wound, a motor vehicle accident, that a life-threatening condition. And I think this is so important to free them of that liability of making a sound clinical decision of referring that patient to a community health center the next day. And I would gladly yield to my friend from Iowa.
Reclaiming my time.
I'm sorry. Back to the gentleman from Arizona.
I just want to make the point. Many states have Good Samaritan laws to encourage a doctor to stop at the scene of an accident and to protect him for services he or she renders at the scene of an accident. Mr. Sutton made the point, or Mr. Braley made the point, that we cover doctors who provide care at a medical clinic created by the federal government, as well we should. And there is a difference between those doctors and the doctors in an emergency room. At the federal health center, we're at least paying the salary of those doctors. In this situation, we're forcing them by the law. EMTALA says you must provide free care in that emergency room, in that hospital. We won't pay them, and we don't cover their liability. No wonder they don't want to show up and provide care. Why would they? They have to give free care and not have their liability covered. It's wrong. I strongly urge my colleagues to support Mr. Deal's amendment.
Time has expired. Are we ready for the vote? Let's proceed to a vote on the Deal amendment. All those in favor say aye. Aye. Opposed, no. No. We're going to go to a roll call vote.
Mr. Waxman.
No.
Mr. Waxman votes no. Mr. Dingell. Mr. Markey. Mr. Boucher. Mr. Pallone. Mr. Pallone votes no. Mr. Gordon. Mr. Rush. Ms. Eshoo. Ms. Eshoo, no. Mr. Stupak. Mr. Stupak, no. Mr. Engel. Mr. Engel, no. Mr. Green. Ms. DeGette. Ms. DeGette, no. Mrs. Capps. Mrs. Capps, no. Mr. Doyle. Mr. Doyle, no. Ms. Harmon. Ms. Harmon votes no. Ms. Schakowsky. Ms. Schakowsky, no. Mr. Gonzalez. Mr. Gonzalez, no. Mr. Inslee. Mr. Inslee, no. Ms. Baldwin. Ms. Baldwin, no. Mr. Ross. Mr. Weiner. Mr. Weiner, no. Mr. Matheson. Mr. Butterfield. Mr. Butterfield, no. Mr. Melanson. Mr. Melanson, no. Mr. Barrow. Mr. Barrow, no. Mr. Hill. Ms. Matsui. Ms. Matsui, no. Mrs. Christensen. Mrs. Christensen, no. Ms. Castor. Ms. Castor, no. Mr. Sarbanes. Mr. Sarbanes, no. Mr. Murphy of Connecticut. Mr. Murphy, no. Mr. Space. Mr. Space, no. Mr. McNerney. Mr. McNerney, no. Ms. Sutton. Ms. Sutton, no. Mr. Braley. Mr. Braley, no. Mr. Welch. Mr. Welch, no. Mr. Barton. Mr. Barton, aye. Mr. Hall. Mr. Hall votes aye. Mr. Upton. Mr. Upton, aye. Mr. Stearns. Mr. Stearns, aye. Mr. Deal. Mr. Deal, aye. Mr. Whitfield. Mr. Whitfield, aye. Mr. Shimkus. Mr. Shattuck. Mr. Shattuck, aye. Mr. Blunt. Mr. Blunt, aye. Mr. Boyer. Mr. Boyer, aye. Mr. Radonovich. Mr. Radonovich, aye. Mr. Pitts. Mr. Pitts, aye. Ms. Bono-Mack. Ms. Bono-Mack, aye. Mr. Walden. Mr. Walden, aye. Mr. Terry. Mr. Terry, no. Mr. Rogers. Mr. Rogers, aye. Mrs. Myrick. Mrs. Myrick, aye. Mr. Sullivan. Mr. Sullivan, aye. Mr. Murphy of Pennsylvania. Mr. Murphy, aye. Mr. Burgess. Mr. Burgess, aye. Ms. Blackburn. Ms. Blackburn, aye. Mr. Gingrey. Mr. Gingrey, aye. Mr. Scalise. Mr. Scalise, aye. Mr. Dingle. Mr. Dingle votes no. Mr. Markey. Mr. Markey, no. Mr. Boucher. Mr. Boucher votes no. Mr. Gordon. Mr. Gordon, aye. Mr. Rush. Mr. Rush, no. Mr. Green. Mr. Green votes no. Mr. Ross. Mr. Ross, no. Mr. Matheson. Mr. Matheson, aye. Mr. Hill. Mr. Hill votes no.
Have all members responded to the call of the roll? Any member wish to change his or her vote? The clerk will tally the vote. Clerk will announce it.
Yeah, Mr. Chairman, on that vote, there were 23 ayes and 35 noes.
23 ayes, 35 noes. The amendment's not agreed to. We're going to open the bill up for amendments to Title A or B. But before we do that, we're going to take a recess so that the clerk's going to put the amendments and get them ready for consideration. So we'll take a 10-minute recess now.